Hi there, it's Julien Barker from Chiropractic here with James, who's just been telling me he's a bit tight on his right hip, so we're going to run through it and have a check of that. So good, up you go. So with the, we'll run through the basic scan, and then we'll check all the actual hip joints and around that, and we'll check the actual hip muscles as well. So they are namely psoas and the glutes and piriformis come up actively. You can actually check hamstrings and quads as well, so we might do that. Your PD is normally right, yeah, you definitely are. Yeah. Okay, and that's there's not a lot in that, but it goes a couple of mil to there, so possibility 1. So we start with the knees. Checking medial and lateral tibia. No real change there at all. Moving up onto pelvis. Start with the left AS ilium. And that is definitely changing. It can actually just double test by doing it on the other side, seeing if we can get it straight back, and I think you can clearly see that. Yeah, push right, and he goes long right, push left, and he clearly levels up. And level is what we're aiming for, so we'll go for that. So, find the PSIS, come across, and one up just to find the top of the sacrum, setting 4. Moving on to the iliac crest, line of drivers anterior inferior, just coming about an inch up off the ischial tuberosity. There we go. And if we actually just do this repeat, then now you can see it's definitely not changing. Good. Squeeze your knees together, and there you go. Let's have your right hand up behind your back, and swap your hands around. Both hands up behind your back together. Back down by sides. Actually, I can feel a little bit of tension on that L4 and 5. It wasn't really coming up. So let's just run that again and check the facet. So right hand behind your back. This one is just a double flex to see if you're getting anything. And we can just do it individually. And that looks to me like we have a very good L5S1 facet. Okay, swap your hands around. In the Activator textbook, this is called position 5. I get nothing on that side, arm back down by side. Okay, so L5S1 facet on the right, is that symptomatically for James, is that feeling a little bit like a right hip stiffness? Yes, certainly close enough to tie up. So, anterior superior on L5, and then on to S1 anterior inferior. So it's going to gap that joint 1.8 millimeters in either direction, so you could say that's a total of 3.2. Take your right hand up by your face. Big deep breath in and out. Left hand up as well. Both back down by sides. Turn your head to the right. Lift the right shoulder off the couch. Back down. Shrug both shoulders up to your ears and down. Squeeze the right elbow flat and let go. Squeeze the left one in and let go. Shrug your shoulders up and roll them back. Then roll them down. Head back into the centre. So probably a good point to make here is that I'm not really finding anything in that mid-thoracic or on the shoulders. One of the great things about Activator is it will tell you when not to adjust as much as it will tell you when to adjust. So does he need anything doing in those there? Well, not really much, which is good. So lift up your head and back down. And tuck your chin down to your chest, back to centre, push face down into the couch, and let go. And it makes a lot of sense that actually if you're testing, but if you're not finding anything, then you don't need to do anything. And the aim of any treatment should be that you don't need to actually do. You need to check, but if you don't need to do anything, leave it alone. Okay, so let's run through, go back to the hip. We'll just start with the QL. So stretch your right hand towards your right knee, and back round. And left hand, left knee, and back round. Yeah, see, nothing going on there at all. Okay, so we can check for internal and external rotation of the hip joint itself. We can also check for inferior and superior. I'm just actually taking a pressure on the trochanter there and pushing either up or down. You can get a lateral, so just a tissue pull, and just pull in there to see if that does anything, which it does not. So glutes test, push the right leg outwards, and let go. You get absolutely nothing, and the piriformis pushing inwards, and let go. Nothing really going on there. Push both knees down into the couch, and let go. And that's the Psoas test, which is also looking good. So, good news. Lift both hips up off the couch together, and back down. This is looking for a superior or inferior sacrum. Nothing going on there at all. Okay, good. Was there any other area of you I ought to be having to think about?
Oh, I think it was just the hip, yeah.
Yeah, fantastic. Good. So it's a really good example that just because you don't find anything doesn't mean to say it's a bad thing, because actually the best thing is to not actually have to do anything. Cheers. See you next time.